working, thinking, turning ideas into concepts, concepts into reality. Our brains signal our bodies to act. Quite naturally, we give no thought to the complex and intricate network that gives us quality of life in our working environment. Our brains communicate, and our hands create art, crafts, furniture, useful, practical things. Problems solved and tasks completed, we feel a deep sense of satisfaction. Take that away through illness, impairment, disability or social circumstances, and our world collapses. The road to recovery can be long and difficult, but it need not be taken alone. Cape Town, a city voted one of the icons of the world, a tourist destination for millions of travellers. It's also home to the University of Cape Town, the country's foremost educational institution and ranked in the top 200 in the world. At the Faculty of Health Sciences campus at Groote Hospital and on the upper and middle campuses of the university, students study for a degree in occupational therapy. Dr. Elelwane Ramagondo outlines the diverse nature of the profession.
Occupational therapy is a broad profession covering many spheres. Pediatric practice, working with children, is one of those spheres. Work practice, where we work with individuals to enable them to get back to productive employment, is another sphere. We have occupational therapists working with people in mental health institutions. We have occupational therapists who work really just on physical difficulties, and that can extend from children to adults.
UCT's Occupational Therapy Department has a close relationship with Red Cross Children's Hospital. Children come from all over Africa to be treated here, and UCT students see acute and often unusual cases. This is baby Thandi. Her mother noticed from an early age that she was having trouble sitting and using her hands. The diagnosis was Guillain-Barré syndrome that can lead to paralysis. Occupational therapy is vital in helping her regain movement of her hands and the ability to walk. OT clinical educator Tamsanqwa Makida highlights the importance of early intervention.
If they don't get the therapy that is needed, it affects their quality of life. It may escalate into permanent disability. So it's very important that the problems are picked up much earlier on for children especially. It's quite amazing what you observe, because you see a child when they are in a state of distress, and 4 or 5 months down the line, depending on how long therapy was, they are back to what they should be, smiling, playing, and enjoying life as children should.
It's also important that therapy is continued beyond the hospital wards.
We try by all means to involve the caregivers or the parents in the intervention process.
OT calls for a special kind of person.
It's someone who's compassionate, somebody who has a passion for people, and someone who's very creative as well. Because a lot of what is required of you is that you become creative based on the theory that has been provided for you by the university. That creativity really will be trained, but some of it should come naturally somehow.
Another important area of occupational therapy centres on mental health. This may range from schizophrenia and mood disorders to depression. This is Zarina Hajwani's area of specialisation.
With people with schizophrenia, often their ability to engage in everyday activities is often lost. Some of the symptoms that they experience will influence their ability to do things that they are used to doing.
When the symptoms are active, people may find they can't work or cope with simple day-to-day tasks. Proper medication helps to stabilise them. This is where occupational therapy takes over.
It starts getting people to start doing things at the level that they're able to. And you will find that the more they're able to do, the more they want to do.
The occupational therapist often matches the patient to an occupation that best suits their skills.
Because they've become a worker, they are now able to be the breadwinner of their family. And because they are the breadwinner of the family, there's a lot more interpersonal relationships that have been enhanced with the family members. Not to mention that there's poverty alleviation with the whole family in general. And there's also the self-esteem and the pride of having achieved something at the end of the day.
One more sphere where occupational therapists increasingly work is community. And that's really where a lot of excitement can be experienced, because it tests the ability of the occupational therapist to collaborate with a whole lot of stakeholders which traditionally occupational therapists have not worked with. So entrepreneurs, community leaders, political figures, community structures, and really it's about following the heartbeat of the community within which the therapist finds themselves. It's very taxing but extremely self-fulfilling.
At Lavana Primary School in Lavender Hill, occupational therapist Dr. Rashan Khalvan involves children in a series of activities that give the therapist unique insight into their lives.
Here at Lavana Primary, what we do is we work with groups of children, either in classes or in clubs. In the classes, we offer campaigns to the children, where we work with the children to identify what their needs are, and based on that, we then put in place a campaign. So it's really forming a partnership with the children.
A group of children were given a project that involved digital photography.
With the Photo Voice projects, the children take photos of themselves engaging in activities, or take photos of issues that are really meaningful to them. Once they've taken the photos, they come back and they speak about, we develop the photos and then give them back to them, and they share it in a group with their friends, and we speak about the issues that affect them. It gives us a tool really with which we can ask more questions about things we know little about. So we visit their homes without really going there sometimes. One of the roles we play is to enable children to articulate their needs. So usually even the process of getting them to identify their needs in itself is a facilitated process.
The programs build self-esteem, awareness and open up lines of communication.
The one big change that we see is that children start attending school. So we're in a community where the school dropout rate is very high and where absenteeism is a real problem. We find children want to come to school because they have a purpose, they have a project that they're really, really enthusiastic about and that they feel that they own.
The OT student has helped us in the sense that you almost have a better understanding of where the learners come from, because they deal with the learners on a one-to-one basis. You can't do that because you don't have the time. But you at least know that there's some assistance, so you don't see them as being separate from the education system, but you see them as being part of developing that learner into becoming a fuller human being.
What is extremely exciting about being an occupational therapist is establishing that perfect match between the capabilities that a human being brings when they interface with occupations that matter to them. When an occupational therapist has assessed what this person is able to do and not able to do, and has done an analysis of the steps of the activities that this person needs to do, that match becomes very possible. And when it happens, it is magic.
Occupational therapy students feel this magic and see the difference they can make from their very first year. It's hard work, but very rewarding.
It changes people's lives. It's amazing because OT, it not only focuses on people, but on what they do and how they live their lives. And often that's what's neglected when people are looked at in terms of rehabilitation.
A personality to do good, and I like being with people and different things every day, and really just seeking to just put people in their place that they want to be in their lives.
You also have to have quite a lot of empathy, I think, to do this kind of work.
Also to be active and also creative enough in helping disabled people.
I wanted to be at UCT because I know that they have a good degree, I know that they're internationally recognized,
I'm in 4th year now, so once you get to the end, you kind of see how everything fits together, and it makes it worth it in the end, because yeah, you need all that information to do what you're doing. You're changing people's lives.
On my wall I have a quote by a 7-year-old boy who says, "Occupational therapists take what's really important to you and change it so that you can do it."